Dr. Bott, when it's time to start therapy, what types of treatments are available for CLL patients?
So when we think about treatment for cancer, we think about chemotherapy, the conventional chemotherapy that's associated with side effects like hair loss, nausea, or vomiting. I'm very happy to say that conventional chemotherapy is no longer the standard of care for patients with CLL. Patients who need treatment for CLL are nowadays treated with what are called targeted agents. And we have in general two different classes of targeted agents that have been approved for treatment for CLL. We have the BTK inhibitors or Bruton's tyrosine kinase inhibitors, of which we have three. We have ibrutinib, we have acalabrutinib, and we have zanubrutinib. Then we have BCL2 inhibitors, of which we currently have one approved, which is called venetoclax. These treatments can be combined with monoclonal antibodies, which are directed towards the antigen called CD20, for example, rituximab or obinutuzumab. Typically, venetoclax is combined with monoclonal antibody as a time-limited therapy. BTK inhibitors usually are not combined with monoclonal antibodies.
What about stem cell transplant? Does that fit in there?
So stem cell transplant still has a role for treatment of patients with CLL, but it has moved down the line with such highly effective and well-tolerated oral agents available. But for refractory patients, what we call dual refractory patients, we definitely are, especially in patients who have high-risk features, we do refer them to stem cell transplant.
And what is a dual refractory patient?
Dual refractory patients mean patients who have had a BTK inhibitor, be it ibrutinib, acalabrutinib, or zanubrutinib, and the disease has progressed on that. And then we give them venetoclax, which is a BCL2 inhibitor. So these are the two classes of targeted agents that we have available. If they have received ibrutinib, acalabrutinib, or zanubrutinib, and after that venetoclax, or venetoclax followed by a BTK inhibitor, and the disease has progressed on both. These patients are called dual refractory, and currently they tend to be very resistant to whatever treatments we have available. And we look at other modalities of treatment, the clinical trials or stem cell transplant for that.